Hello, and welcome to the MedCenter Show. My name is Michael Prilutsky, and I'm the Chief Operating Officer of the Jersey City Medical Center, filling in for Joe Scott today. Today, we have two guests with us, Dr. Pragnesh Gadhvi, cardiology, and Dr. Tyrone Kraus, cardiothoracic surgery, two members of the Heart Center at the Jersey City Medical Center. First of all, Dr. Gadhvi, welcome, and thank you for coming.
Glad to be here.
Dr. Kraus?
Thank you.
Thank you. So, Dr. Gadhvi, tell us a little bit about yourself, your background, your training. We'll start there.
So I am an interventional cardiologist. Did most of my training in Chicago. After completing residency and a fellowship in cardiovascular disease at the University of Illinois, I came to New York City, and did a additional fellowship in interventional cardiology at Lenox Hill Hospital in Manhattan. Since then, I worked for a few years, and beginning of 2007, moved to New Jersey, the Garden State, and established my practice, and I've been here for the past 10, 12 years.
That's great. So you trained in Chicago and New York, but came to practice in Jersey City.
Exactly.
What made that decision for you?
Well, interesting question. I think when I was practicing in New York, there were quite a few patients that were coming from New Jersey to seek advice and consultations. And there's a growing need for advanced therapeutics. And when I found that Jersey City Medical Center offered these same modalities where I can treat these patients, I chose to establish my practice here, where the tools that we have are very capable of treating these patients without patients having to come across to the city.
That's great. So, Dr. Kraus,
Yes.
welcome and thank you as well.
Thank you.
Same question to you, really. Tell us a bit about yourself and how you came to be in Jersey City.
Yeah, well, I'm born and raised in New York and went through all New York schools, NYU undergrad. Ultimately did my cardiothoracic surgery at Cornell in New York. When I graduated from there 25 years ago, I took my first job in New Brunswick in New Jersey, and I've been in New Jersey ever since. Recently, well, not so recently, but 2012, I became the chair of surgery at Jersey City Medical Center, where I've been till now, doing all aspects of adult cardiac surgery, excluding transplant and pediatrics. So it comprises valve surgery, minimally invasive valve surgery, coronary artery bypass, complex bypass cases, aneurysm surgery, and different aspects of valve surgery that are what we say now is minimally invasive, which is very small incisions for valves. But we also, as Dr. Gadhvi will talk to you about, we cover the whole spectrum of heart surgery, from diagnostic to the treatment, and from simple to the complex.
And so cardiac surgery, it's a wow thing, right? It's something you hear at parties, cardiac surgery, neurosurgery. So what made you want to become a cardiothoracic surgeon?
Well, I don't know if anyone wants to do it before they really understand what it's about. I think for me, I knew I wanted to be a surgeon when I did my residency at Robert Wood Johnson. I spent 6 years there. And each year you rotate through different specialties, and you try to see what's for you, what you can do, and what you like the most. And when in my second year, I did a rotation in the cardiac surgery service at Robert Wood Johnson, and I was basically felt like it was made for me, and there was nothing else that I wanted to do. And I think that's kind of there's really no secret to how you become something, at least in my case.
That's wonderful.
Yeah.
And so let's talk about what you guys do day to day. So Dr. Gadhvi, there's so much conversation now out there about prevention, about staying healthy. Assuming that nobody truly wants to be in a cardiologist's office because there's an emergency. What are the risk factors, and how do we try to stay healthy from a heart and vascular perspective?
Sure. Well, one of the things that we know is that coronary artery disease or problems of the heart is the #1 killer, not only in the United States but abroad. The typical risk factors that we all hear of and speak of, such as high blood pressure, diabetes, the presence of high cholesterol, smoking, whether it's a family history or inheritance patterns that cause coronary artery disease, obesity, weight gain, physical inactivity. These are all the common risk factors that actually bring about the process of coronary artery disease. So it begins with trying to control these risk factors. Easier said than done. We all know that we need to control these risk factors, but what we fail to realize is the negative impact of not controlling them, and it culminates into disastrous complications, and we see those day in and day out when we treat these patients that are suffering from heart attacks.
So what happens when the patient comes to your office? What services do you offer? What screening diagnostic procedures do you offer? Sure. What do you do with a patient that comes to you in trouble?
Well, the initial evaluation of any patient is a thorough consultation looking at what risk factors they have. We do laboratory testing to see if their cholesterol is elevated. We measure their blood pressure. We go further and use certain diagnostic tools to see if there's any evidence of damage or already early signs of stress, such as a cardiac ultrasound, looking at the way their heart is pumping, looking at the way their valves are functioning. We also go deeper and using tools such as stress testing to see patients sometimes may not feel chest pain because they don't do the amount of physical activity required to bring about the symptoms, but stress testing is a nice way for us to see if there's any micro changes that occur, whether it's a problem with circulation or whether it's a problem with irregular heartbeats and whatnot, to try to identify if these patients are at higher risk and need early treatment.
And so here you are sitting next to Dr. Kraus, members of a team for the Heart Center. So how does it work where the patient needs to make a transition from cardiology to cardiac surgery?
That's a great question. I think that if you look at historically, specialties were sort of segregated from primary care. And what I feel that the modern era of medicine, it's not surprising. I mean, we welcome specialists such as cardiothoracic surgeons, vascular specialists, and we try to have a multidisciplinary approach. We know that medical therapy has evolved over the years, but what we want to do is bring about all specialists together and make the right decision to give the patient the best outcome.
So when we come back, we'll talk about this teamwork approach. We'll hear from Dr. Kraus. But in the meantime, we'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunley Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
The Jersey City Medical Center. You know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together. It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. Visit us on the web at barnabashealth.org.
Welcome back. We're sitting here with Dr. Kraus, Dr. Godwin, talking about the Heart Center at Jersey City Medical Center and what the patient should expect should they need our services. So we finished last segment talking about teamwork and transition from cardiology to heart surgery. So Dr. Kraus, what does it look like from your perspective?
Well, I think it's changed a lot in the last 25 years, but I think teamwork, as Dr. Godwin had mentioned in the first segment, is so important in cardiac treatment. The treatment begins with medications, and then it progresses to perhaps an interventional or at least a diagnostic study to determine if there is a coronary artery problem, for example, or a valvular problem. And quite often those problems can be dealt with medically. As a matter of fact, most of them can be. And then ultimately, and Dr. Godwin will talk about this, about the interventional part of fixing particular valvular problems or fixing particular coronary problems. But we especially work close when he comes across a problem that he can't fix. And that's when he'll give the cardiac surgeon a call. And we'll get involved with perhaps discussing, or we have our meetings where we have joint effort put in by either the cardiologist, other ancillary care personnel, myself included, where we'll discuss the pros and cons, the risks and benefits to the patient. We include the patient in the decision. Some patients will not want surgery at all costs, and we have to deal with that. But we have a comprehensive center at Jersey City Medical Center. We have excellent nursing with the Magnet Award as long as I've been there, and Leapfrog. So I think all aspects of care at Jersey City is taken care of.
So as you mentioned, heart surgery, or certainly heart care, is a team sport. It takes cardiology, it takes cardiac surgery, but as you mentioned, it also takes nursing. And yes, we do have a magnet status at the Jersey City Medical Center. It takes quality, safety, and training. And we have a rating from Leapfrog at the Jersey City Medical Center for the last 12 rating periods.
Right.
I think under 60 hospitals in the country out of 3,000 can say that. So certainly, what do you tell your patients when they come to see you and now their life literally is in your hands? How do you make them at ease? How do you prepare them for surgery?
Well, one of the biggest things that is on their mind, not so much, well, certainly the technical ability of the surgeons. They always check everyone out online, and it's easily done. We have a report card, which is put out every year with all of our data on the report card. So, and we have an excellent record. The surgeons at Jersey City. But also they want to know about what you just mentioned, the ancillary care, the aftercare, because you could do a perfect operation and you want things to go well post-operatively. And what's included in the comprehensive care is the cardiologist seeing the patient every day, multiple times a day, the nursing who are specialized in open heart exclusively, intensive care.
So the nurses, I'm sorry to interrupt, are specially trained for open heart surgery.
Correct.
And work in a special unit in the hospital that takes care only of open heart patients.
Right. There's a designated area with designated nurses that just do the, and it's a whole team from anesthesia who are fellowship trained in cardiac surgery. We have 4 members that only work with us in cardiac surgery. And the nursing in the operating room also are specially trained for open heart. So when we say comprehensive, right from even to the rehab, the disposition of a patient after surgery. Some patients opt to get a little extra physical therapy before going home, and we would set that up immediately after surgery to facilitate their rehabilitation.
And so, Dr. Godwin, as Dr. Kraus just mentioned, so you actually don't leave your patient. You still go see the patient in the hospital every day?
Absolutely. We see these patients, we've known these patients before surgery. We send them through the process of getting evaluated for surgery, and then we're seeing them each and every day during their surgery up until discharge, and then we see them back in the offices again.
And so what kind of rehabilitation services take place after discharge from the hospital?
So many times these patients go through numerous pathways. Some patients are well enough to be discharged to home directly. Some patients require the need for ancillary services such as subacute rehab or transitional rehabilitation. Some patients need cardiac rehab to improve their performance levels before they're ready to be discharged. Some patients need a combination of cardiac and neuro or pulmonary rehab, but we have all ancillary facilities available, and we have colleagues that work in these facilities so we can help the patients transition to these individual areas.
So our goal for this transition is to send the patient home and do the rehab at home, not necessarily in institutional setting?
Well, I mean, studies have suggested that some patients with cardiac disease do benefit from cardiac rehab. So it's not always a means of trying to get the patient home, but it's trying to offer the best standard of care to allow them to have the best outcomes.
That's great. So Jersey City is one of the most diverse cities in the country.
Absolutely. That's one of the reasons that drew me into practicing in this area. We have a very, very diverse ethnic population. And as I talked about in my first segment, risk factors for coronary artery disease, what we're seeing is that over time, the number of acute heart attacks, and what I mean by heart attacks that completely block the artery, we're doing well with reducing those, but we've started to pick up on other minor or secondary heart attacks, which be it because of advanced technique, advanced diagnosis, early point-of-care testing that we have at the medical center. But at the same time, what we're seeing is that there are individual populations that have intrinsic risks that are above and beyond these traditional risk factors. And that is what Jersey City is about. So recognizing the cultural variances is very important. And I think that our colleagues here are well trained, and we communicate well enough and educate ourselves in recognizing what we need to do for these individual populations.
And Dr. Kraus, how does it affect your practice, these cultural differences?
It doesn't, because we have so much help at the hospital, whether it be interpreters, cultural interpreters, all sorts of different ways of dealing with these cultural differences. And they've had so much experience with it at Jersey City Medical Center. It's not something that's a new phenomenon. They've had decades of experience with it. And I think, I'm sorry.
No, as Dr. Kraus was pointing out, I think that the important thing is that we want to improve outcomes. We want to improve quality, but I think at the same time we want to make sure that the patients are confident in that we have given them all the options. And that is what the comprehensive approach is about, and that is why we're proud to be in a situation in which we can communicate and offer the patients what they really truly deserve.
Great care, safe, quality, great care.
Absolutely.
And we'll be right back with the next segment.
Meineke Car Care, conveniently located at 700 Tunnelly Avenue, Jersey City, half a mile north of County Road. Meineke bumper-to-bumper car care. Brakes, exhaust, oil change, wheel alignments, batteries, CV joints, and so much more. First-rate service at a price you can afford. All major cards accepted. Apply for a Meineke card. Meineke, Jersey City. Stop by and let Sammy check your brakes for free.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to newportng.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. newportnj.com. Newport, live like you want.
Pan & Pinto Properties, Jersey City. Shaping the workplace with state-of-the-art office spaces that address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panandpintoproperties.com. Pan & Pinto Properties, building Jersey City for everyone.
And welcome back. We are here again with Dr. Kraus, Dr. Godwin, members of the Heart Center at the Jersey City Medical Center. We'll talk now about some high-end procedures that are available at the center and what the future holds for heart and vascular disease. So, Dr. Godwin, let's start with you. So, the Jersey City Medical Center is currently replacing one of its cath labs. Mm-hmm. That's a multi-million-dollar investment in the future of care at the Heart Center. Mm-hmm. Talk to us a little bit about what happens in the cath lab and what future holds there.
Sure. Well, we've come a long way. In the past 50 years, the first angioplasty, which is the balloon, using a balloon to open up the artery, occurred back in 1977.
In Kansas City? Or?
Well, it was done simultaneously. The first one was done at Lenox Hill, where I trained.
Yeah.
The other one was in San Francisco in St. Mary's. But since then, 50 years later, we are at the forefront of continued innovation. In our cath lab in particular, we have our fourth generation of stents, the drug-coated stents, which is the fourth generation, which are thinner.
And I'm sorry to interrupt, and the stent is?
So the first angioplasty was done in 1977, and since then, a simple balloon to open up the artery, we felt and we knew from data and outcomes that wasn't enough. So then they made a metal stent, which is actually a metal spring-like device that we insert into the arteries to keep that artery open. Since then, we realized that that was not enough. So we went with a special drug coating on the stents to prevent that artery from developing an inflammatory response. So since the first drug-eluting stent, now we have fourth-generation stents that are thinner, easier to deliver, and allowing us to do more and more complex cases where we see the gray zone between which will require surgery and which will require angiographic procedures and intervention. We use intravascular ultrasound, which is not just ultrasound of the heart, but we can go in with angioscopes and actually image the inside of the artery to determine the composition of plaque. We have special tools that we use to measure the pressure differences between arteries and between blockages in the arteries.
And why is that important to?
It's very important because it allows us to see that if there is a lesion that needs to be truly treated or not, this can kind of help us differentiate which patients and select the patients that actually will benefit from a stent rather than putting in a stent just blindly when you see these lesions. And many of these arteries that have negative FFR can often be treated with medications and avoid stents.
Negative FFR for our audience?
FFR would be the pressure. If the pressure difference is not significant, then a stent may not be required.
And is there a fifth, sixth generation stent
they're coming.
Down the pipe?
They're coming. I think we now recently have started to see smaller and smaller stents, which in the past we were not able to treat certain arteries because of the small size. The minimum stent was as much as 2.25 millimeters. Now we're seeing stents coming out in the near future to be 2 millimeters in length.
And
which is very important.
I'm sorry to interrupt, and I'm reading some stents will dissolve.
Absolutely. What we would like to see is that rather than leaving foreign body inside the artery, we want to see if we can actually open up that artery for a period of time, treat with the special material, and then have that stent resorb itself. So the bioabsorbable stents have shown promise, and they're coming. There are certain areas where we need to treat the artery, but they have side branches that we don't want to pinch or close. And bifurcation stents are also in the upcoming future, which are actually being used as we speak. And these will allow us to treat more and more complex vessels.
And all this is and will be available at the Jersey City Medical Center?
Majority of it is already available at Medical Center, and the new devices are soon to be coming within the next few years.
That's wonderful. So, Dr. Kraus,
Yes.
what's coming up for cardiac surgery? Right now, I see some patients when I round that have large openings in their chest. They're sitting there with their red pillows.
Yeah.
What's the future holding?
Well, I think just to repeat, we do all aspects of heart surgery. So we do coronary bypass, we do complex coronary bypass, but we also do off pump. Many of our patients ask about that.
And when you say off pump, can you explain that a little bit?
Yes, off pump is ordinarily the heart-lung machine is what we use to do the bypass to keep the heart still and bloodless. And we've developed techniques over the last 20 years to at selected patients not go on bypass to minimize some of the inflammatory effects, some of the complications related to the heart-lung machine. So that's so we offer the off pump. We offer conventional valve surgery, complex or reoperations, but we also, as you mentioned just now with the pillow, instead of having an incision like this on your chest, you can have a 7-centimeter incision, which is about two inches, and we actually measure 7 centimeters when we make the incision, and we do it either on the side or in the midline, and that's for aortic valve or the mitral valve, and then a little further down the pike, but also we've done all aspects of aneurysm surgery. So if you have a complex or even just a simple aneurysm, an aneurysm again is a dilatation of the main artery of the aorta.
It's expansion of the artery.
It's an expansion of it, and once it reaches a certain size, it could spontaneously rupture. So if you have an aneurysm, we have a comprehensive clinic that could evaluate any aneurysm. And we follow you periodically. And then last, we have a TAVR clinic. As you probably heard about the percutaneous valve placement, we don't do the valve placement ourselves just yet, but we do it at another institution. But we have a screening program so that we could selectively look at any patient and decide whether they need.
And TAVR stands for, again, this is for
It's
our audience.
a transcutaneous aortic valve replacement. So TAVR, transcutaneous aortic valve replacement.
And this is a minimally invasive procedure.
Well, it's super minimally invasive because you don't even make an incision on the chest at all. It's all done in the cath lab through a catheter, as if you're getting an angioplasty or a catheterization.
So any Jersey City or Bayonne or any neighborhood patient who may need this procedure can come to us in Jersey City Medical Center, to where we'll advise, we'll screen appropriately, and we'll prep that patient, and then the rehab can be back next to their home.
Absolutely.
That's great. Well, I certainly appreciate you guys joining us today.
Thank you.
Thank you for taking the time.
Sure.
We spent some segments learning about the Heart Center at the Jersey City Medical Center. Dr. Kraus, Dr. Godwin, everything they do for us at the Medical Center and for this community. Again, thank you for joining us, and that's a wrap. welcome to the Med Center Show. My name is Michael Perlutsky. I'm the Chief Operating Officer for the Jersey City Medical Center. And today we have Dr. Eitan Spire joining us, gastroenterologist at the Jersey City Medical Center. Dr. Spire, welcome and thank you.
Thanks for having me.
So to start, to introduce you to our audience, let's talk a bit about you, your background, your training. So take us through that.
Got it. So I grew up in northern New Jersey. I ended up going to college in Pennsylvania at the University of Pennsylvania. From there, I ended up back in New York for med school at NYU. Did 4 years of med school at NYU. From there, I continued at NYU to do my internship and residency in internal medicine. After that, I did a year at NYU as a hospitalist scholar.
And what does that mean, actually? You were a scholar after the medical school?
Yeah, it's a title there. Basically, it's sort of an in-between year, in between my residency and my fellowship, where I was hospitalist at NYU, at Langone Medical Center, and also did some research on the side. So with their hospice program and did a little bit of research.
So what was the research you were doing at the time?
I did GI research at the time. I did GI research into some of the infectious diseases of the GI tract.
Okay.
And from there, I was lucky enough to get a fellowship at Montefiore Medical Center in the Bronx, where I was able to train with some of the preeminent leaders, some of the leaders in the field in gastroenterology. And I did that for 3 years.
And Montefiore is one of the biggest academic medical centers in the country.
Yes, it is all over the Bronx, and it's quite large. Actually, in fellowship, we actually are not in one hospital. We're at 4 hospitals associated with Montefiore.
So that's a big program, a lot of training there.
Yep. There are 12 fellows at a time throughout the program, which makes it one of the larger programs in the country.
Okay.
And then from there, I came back to New Jersey and joined my father's practice and ended up back in Jersey City.
So did you have a choice to stay in New York, or it was predetermined you're coming to Jersey City to join your father?
No, I never felt any pressure from my father.
Yeah.
It was not, I had a choice of going where I wanted to. Obviously, I had family, both my family and my wife's family in this area, and so it was a natural fit.
So your father is also a gastroenterologist?
Yes, he's a gastroenterologist also. He's been practicing out in New Jersey, ever since I can remember.
So there's some history for Dr. Spire in New Jersey and in Jersey City.
Yes, my father grew up in New York, but when he started practicing, he came out to New Jersey. But my mom's family actually is from New Jersey. So my great-great-grandfather was a rabbi at a synagogue in Jersey City.
In Jersey City?
In Jersey City.
Wow, okay.
Don't ask me the name, I don't know at this point.
Yeah.
My mother grew up in Jersey City. She went to school around Journal Square. And my grandfather had a business in Jersey City on Communico Avenue, an Army-Navy surplus.
Army-Navy, so from Army-Navy surplus to GI practice in Jersey City.
Yes, exactly. And as growing up, by the time I was a child, he had moved to Bayonne, but I visited my grandfather all the time. He lived on a place on Kennedy Avenue. Used to go to the park with him right across the street. So been in Jersey City a long time. Jersey City area a long time.
Sure, that's a full circle for you. So you went to school in Pennsylvania, trained in New York, and then came back here to your family roots in Jersey City.
Exactly.
So do you know Jersey City Medical Center? Have you been there before you started practice?
So no. So before I started practice, I've heard of Jersey City Medical Center. I hadn't really knew much about the new campus. But when I came out here, my father was out here, and so I joined onto the staff and have become very acquainted with Jersey City Medical Center.
So where is your practice located?
So we have offices in Jersey City. We also have offices in Belleville and also in Newark.
And how does one reach your offices? Is there a phone number? You can give a phone number, that's fine.
So the phone number, I actually don't know the phone number.
Don't worry about it. We'll flash it later.
Yeah. Just call and you can make an appointment anytime. There every week.
Yeah, so Jersey City is a very diverse city at this point. It's probably one of the most diverse cities in the country. So who comes to your practice? What problems, issues do you see as a gastroenterologist?
So as a gastroenterologist, we deal with disease of the entire GI tract. So it's the study of the normal function and diseases of the entire gastrointestinal tract, including the esophagus, stomach, small intestine, large intestine, or colon and rectum, pancreas, liver, gallbladder, and bile duct. So really a whole host of organs in the body. And so we deal with all of those diseases, and we see all those diseases fairly commonly. Obviously, the most common ones we see are often just colon cancer screening, not necessarily disease, but very important. And then we deal with reflux, heartburn, ulcer disease. Those are fairly common, and then less common but also important diseases like inflammatory bowel disease, any disease of the pancreas, pancreatitis, any liver diseases, which can be common.
So we know a lot at this point about GI diseases, and we know what not to do, so to avoid your offices.
Yeah.
So take us through that a little bit. What are some of the preventive strategies not to be in your office as a patient?
So not to be in my office as a patient in terms of just healthiness. So obviously you want to eat healthy.
And what does that mean? I mean,
so that's a good question. Not entirely clear, but obviously a diet high in rich in fruits and vegetables, high in fiber, tend to decrease some of the diseases that we see with GI. For heartburn per se, you want to avoid spicy foods, greasy foods. Tomatoes can cause problems.
I love
all the good
tomatoes.
stuff. So
no, don't say tomatoes, really?
Yeah.
I thought they were healthy.
They're healthy, but not necessarily. But for heartburn, they can worsen heartburn. Chocolate, alcohol, especially red wine. So
all the good stuff.
Yeah.
And chocolate goes with red wine, so it's just a no-no?
For heartburn, yes.
Okay.
For a glass of wine a day is not a bad thing, but for heartburn, it can be a problem. And then, honestly, not necessarily for avoiding our office, but for just general health, colon cancer screening is very important.
It's interesting.
And
so here we are with Dr. Spire. We'll be back and we'll talk about colon cancer screening and other services at his office and at the Jersey City Medical Center. We'll be right back.
Good Friend Self Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self Storage. Let us be your good friend.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunnelly Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunnelly Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. The Jersey City Medical Center, you know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Welcome back. We're here with Dr. Spire, gastroenterology attending at the Jersey City Medical Center, and truly somebody who has a family history at Jersey City. Dr. Spire, thank you for taking the time. And again, let's talk about the screening processes. Let's talk about detecting disease and what one should be ready for, what are the guidelines, when one should do it, etc. So in the end, one doesn't have to be sick necessarily to see a GI physician.
Right. So I'll talk briefly about why it's so important to get done in the first place. So colon cancer is the second most common cause of cancer death in the U.S. About 50,000 people a year will die from colon cancer. It affects men and women fairly equally, maybe men a little more predominantly, although because women tend to live longer, the actual sort of effect on both is about the same. And you have about a 1 in 5 chance in your lifetime, 1 in 20 chance in your lifetime of developing colon cancer. And so screening is very important. There are lots of screening methods out there, but as a GI, colonoscopy especially is unique in that it both can screen for colon cancer and can prevent colon cancer. So at the time of the colonoscopy, we can take out the lesions, the precancerous lesions that can lead to colon cancer.
So at what age should one start getting colonoscopies?
So if you are average risk, meaning you don't have an extensive family history of colon cancer, at 50. If you are...
And this is men and women?
Men and women at 50. The one caveat to that is if you are a non-Hispanic Black, some people would say start at 45 because there is increased risk in that population.
And so there's a good chunk of Jersey City population that really should start at 45.
Yes.
Okay.
And then depending on the results of that first colonoscopy will determine how frequently you need to be tested in the future.
And so there's a bunch of jokes about the colonoscopy experience out there, and so it doesn't have the most pleasant reputations.
No.
And so it doesn't sound like it's avoidable. Is there a small pill one can swallow and go into the CAT scan and avoid it entirely? Does that work?
No. And again, there are other methods of screening. CT colonography is one of them, but honestly, that doesn't even avoid what I consider to be the most unpleasant part of the whole process, which is taking the prep beforehand, the stuff you have to drink to clean you out, to make sure make sure you can see the precancerous lesions, the adenomas or polyps, when we do the procedure.
And so take us through the prep for the colonoscopy. Yes. What should one expect before, I guess, during, and after?
So you should expect fairly detailed instructions from whoever is doing the procedure, which will help you, obviously, the day before, to remember everything that needs to be done. But the day before, you'll most likely be able to eat a light breakfast. Starting at lunch in the afternoon, you'll have to be only on liquids. And then starting that evening, you will take the preparation, which is the liquid you have to drink that will clean you out. Depending on the instructions from your gastroenterologist, they'll have you take everything that evening before you go to bed, or sometimes they will have you drink half, what we call split prep, half that evening, and then half or very early in the morning before the colonoscopy, because you do have to finish drinking everything about at least 3 hours before the procedure. The advantage of doing the split, although it can be a little more difficult, obviously waking up very early in the morning, is that you tend to be cleaner. And the better the view, the better the colonoscopy, the more polyps we can find, the less chance you have of developing colon cancer.
And should you have somebody take you to the colonoscopy?
Yes, so that's the day before. Then the day of the procedure, because you'll most likely be getting anesthesia for the procedure, you won't be able to drive home. So you can't show up to the procedure by yourself, but you need to make sure you have some way of getting home someone to help you get home because you will not be able to drive after the procedure.
So how do you determine if anesthesia is going to be given to a patient or not?
So for the most part, unless the patient requests no anesthesia, you will be getting anesthesia, and that's for patient comfort. You know, without the anesthesia, it can be a little bit uncomfortable because we're putting air into the colon that distends the colon or makes it bigger, and people feel that, sort of feel very gassy, and that can be very uncomfortable. But with anesthesia, you don't feel anything, and for the most part, you don't feel anything, and most people don't even remember the procedure. They wake up and say, you know, when are we starting?
That's great. So how quickly do the patients know the results of the colonoscopy?
So pretty much immediately. So once the anesthesia wears off, which is basically right away, so the procedure itself is usually no longer than half an hour, and that's at the top end. You'll wake up pretty much right away, and then the doctor who did the procedure, the gastroenterologist who did the procedure, will be able to tell you what they saw, what they took out, what they saw, what they found. The only thing you won't know is if any polyps are taken out, or you will not know what type of polyp they are 100% until the gastroenterologist gets that information back from the pathologist, and that usually takes a couple days.
And so you mentioned earlier, so just to confirm, so when one has a colonoscopy, there's also treatment,
Yes.
not just diagnosis.
So the great advantage of the colonoscopy is that not only do we detect these precancerous lesions or polyps, it's that we can take them out. So colon cancer is thought to develop in a fairly linear progression from a small polyp or adenoma to a large polyp to a polyp with early changes of cancer or dysplasia, and finally to cancer itself. During colonoscopy, we can find these polyps when they're small and take them out. We can find them when they're large and take them out, and we can also find them when they're very, very early stage colon cancer and take them out, and that can be a cure for colon cancer if it has progressed to that point. And again, these changes take place, we think, over probably a period of at least 10 years, maybe a little bit longer than that.
And so these procedures, colonoscopies, so we do them at the Jersey City Medical Center?
Yes, so we do them at Jersey City Medical Center. We have an endoscopy unit there, a great endoscopy unit with highly trained nurses, highly trained techs, highly trained staff to help out after the procedure. And there are, me included, but a bunch of other gastroenterologists who will do this procedure at Jersey City Medical Center. And we're taking a look at all the high-quality markers of colonoscopy that ensure that you get not just colonoscopy, but a quality colonoscopy, and that includes making sure we're detecting enough of these small polyps, because there is a certain number that you should be detecting to make sure that you're doing a quality procedure.
And so what kind of equipment do we have at our endoscopy suite at the Jersey City Medical Center?
So we have a whole host of the latest equipment and endoscopic equipment. So obviously we have colonoscopes, which are the tools we use to do the procedure, and these are tubes, thin tubes with cameras on the end of it that we insert to be able to look at the whole colon. We also have endoscopes, which are basically the same thing, except we use that to look into the stomach and small intestine when we're looking for ulcer disease or other causes of abdominal pain in patients. And then we have more advanced procedures, scopes for ERCP, which tend to look at the biliary system and can look at the pancreatic duct. And then also we have more advanced even gastroenterologists who also do further procedures like endoscopic ultrasound, which is ultrasound you can do from inside the gastroenterologist.
So when we come back, we'll talk about more advanced procedures at the Jersey City Medical Center. We'll be right back.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Rama Jewelers, located in the Lyndhurst Shopping Center at 413 Valley Brook Avenue, Lyndhurst. Come for all your jeweler needs at Rama Jewelers, where you will find a fine selection of necklaces, earrings, rings, and bracelets. Choose from one of our complete sets, our many signature items, or find the perfect engagement ring. Come on down. That's Rama Jewelers at 413 Valley Brook Ave, Lyndhurst. Call 201-939-5784 or visit us online today.
Meineke Car Care, conveniently located at 700 Tunnelly Avenue, Jersey City, half a mile north of County Road. Meineke bumper-to-bumper car care. Brakes, exhaust, oil change, wheel alignments, batteries, CV joints, and so much more. First-rate service at a price you can afford. All major cards accepted. Apply for a Meineke card. Meineke, Jersey City. Stop by and let Sammy check your brakes for free.
Welcome back. We're sitting talking with Dr. Spira, gastroenterologist at the Jersey City Medical Center. So, Dr. Spira, at the last segment, we started talking about advanced procedures, advanced equipment available at the medical center.
Yeah.
Talk more about that, please.
So one of the more advanced pieces of equipment we have is something called an endoscopic ultrasound, which is an ultrasound that you're able to do from inside the GI tract, which lets you get a closer look at a lot of the organs in the upper GI tract. Let you look at pancreas for pancreatic disease, and then in certain cases let you even do more aggressive interventions from inside the GI tract.
So how would you do the interventions?
So that would be a highly trained endoscopist can actually put needles or other instruments through the walls of the GI tract into areas outside the GI tract. Not something we normally do, but we have the equipment available in case it needs to be done.
And so we talked about gastroenterology and colonoscopies and screening for colon cancer. But in our first segment, you talked about gastroenterology as being a specialty for all GI organs. Right. So talk a little bit about disease processes, what people should be aware of as it relates to, let's say, liver disease or pancreatic disease. Talk more about that, please.
So liver disease in particular is another area in this country where we have a significant burden of disease. So there are national recommendations to screen all baby boomers for hepatitis C, which is a virus that affects the liver. And we do that at Jersey City. And hepatitis C over time causes damage to the liver and causes scarring in the liver. And so that can lead to significant disease. In addition, other things that can cause scarring in the liver, especially in this country, since we have an obesity epidemic, fat on the liver can cause inflammation, something we call NASH, which is non-alcoholic steatohepatitis, which can lead to scarring on the liver and cirrhosis. And at Jersey City Medical Center, we actually have, so one of the ways of diagnosing cirrhosis is to do a liver biopsy, where we stick a needle from the outside into the liver. But there are new non-invasive ways that have been developed to evaluate people whether they have this scarring, and we have that equipment available at Jersey City also. So we have a FibroScan, which is almost like a special type of ultrasound in a sense, although not exactly, that can be just put a probe on the outside and assess how much scarring there is on the liver.
So we can do a full spectrum of diagnosis in gastroenterology at the Jersey City Medical Center. That's great. Yeah. And so the diversity of the population, what spectrum of disease do you see?
So you see it all. In part of my training, especially when I was at NYU, we had exposure to all spectrum or diversity of patients. You have the NYU hospital, you have the public hospital of Bellevue, and you have the Veterans Hospital, the VA. And obviously in the Bronx, at Montefiore, we have a whole diverse population, and at Jersey City we have a whole diverse population. It brings with it some challenges, but it also brings with it a whole diversity of disease, which is exciting as a gastroenterologist. Keeps you up to date, that keeps you exposed to all aspects of gastroenterology, and it's also something that we can bring in my interactions with the residents at Jersey City, helps teach them and allows me to stay current.
So talk about that a little bit. So there's a teaching program at the medical center. So what does that do for you as an attending clinician?
I love it. So it's great, obviously, to be able to teach, residents what you know about gastroenterology, but also pique their interest in gastroenterology and sort of recruit new gastroenterologists for the future. And, their questions, sometimes you don't know the exact answer to their questions, and it keeps you up to date, makes you not, get stuck in a rut of sort of daily private practice. And it keeps you, again, sort of fresh and up to date and interested in your field.
So the fact that Jersey City Medical Center is a teaching hospital is of great benefit to the patient, because that's the latest, greatest concepts in care.
Yes.
And the latest, greatest science.
I think teaching programs are good for patients. Sometimes they're a little hesitant to be treated by someone who they think as a trainee, but these are not trainees, they're doctors. They've gotten their medical degrees, they're already doctors. And so they're often more invested sometimes in care than someone who is not in training.
So let's transition a little bit. Let's talk about what happens, God forbid, there's a positive result with a colonoscopy.
Yep.
So the patient comes to you with best of hopes, and yet there's a problem.
Yep.
There's cancer detected. What's the next step in your practice? How do you really provide full care to the patient?
So it is definitely a multidisciplinary approach. No specialty in medicine can exist in a vacuum by itself. So we have, because we're at Jersey City, we have access to other specialists, other well-trained world-class specialists who we would then refer care to. And so usually with colon cancer, that entails a combination, or sometimes one or the other, of surgery and chemotherapy, oncology. And so we have great oncologists we work at Jersey City, and we have great colorectal or general surgeons we work at, who then we can sort of refer our patients to in confidence that they'll be treated well.
So we provide that full spectrum of intervention and potential cure. And do the patients come back to see you? Do you go see the patients? How does it work to where they don't lose touch?
Yeah, so when they're in the hospital, we'll see them, we'll visit them, even though at that point, unfortunately, there's not much that we can offer, but we can offer them our guidance and our expertise in, in what to expect and what maybe, what we would choose. And then in terms of follow-up, we always have the patients follow up in our office, even if we're not necessarily providing the primary modality of care at that point. Because, it's important for the patient to know that they can always come back to us and ask us any questions or get any advice that they need. But also in the future, presuming that their colon cancer can be cured and can be treated, they will need further colonoscopies in the future to make sure that the colon cancer does not come back or a new colon cancer doesn't develop.
Well, that's great to hear. So we provide full spectrum of gastroenterology care, from detection to minimally invasive treatment to surgical intervention, and then we have the follow-up with our gastroenterologists as needed.
Yes.
That's great. So once again, thank you for coming. Thank you for spending time with us. And this has been Dr. Spira, gastroenterology at the Jersey City Medical Center. Thank you.